Hello, this is Ken Barron with another podcast and videocast going to a number of projects. I'm affiliated with the National Association of Black and White Men Together. And today I want to talk about having to work for your healthcare. And the background for this, of course, is it really an entitlement? Is it a right to have healthcare, live a healthy life, and enjoy your freedom? Beyond that, not be worried about it. Well, when Congress passed President Trump's signature domestic policy bill last month, they voted to take healthcare coverage away from about 10 million people. In the past, they openly boasted about part of it. About half of the 10 million will have coverage removed because of a new requirement that people who are enrolled in Medicare have to prove that they are working, looking for work, or unable to work. Funds generated will be used to finance the big tax cuts that the administration has got for the wealthy. Republicans have put more stock in an idea that has long been part of the American conversation about healthcare, that it is a benefit one earns by working. Work requirements have overwhelming support among Republicans, and some polls have found that about half of the Democrats back the idea too. Well, Democrats have warned also that some people who do work will lose Medicare because they can't file the right paperwork and it's just too unwieldy. The United States' large uninsured population has forced the creation of a vast ad hoc safety net that fills the gap in a patchwork system. In the years following World War II, most of the United States peer countries were creating universal health coverage. Each put its own spin on the idea. Britain, where I come from, made doctors government employees when it built its national health system in 1948. Canada's coverage scheme relied on public insurance that paid private doctors for care. Australia came up with a two-tier system, basic public insurance for everybody, with the option to buy a private plan for more generous benefits. Of course, the United States took a completely different path. It tied insurance to employment. American companies facing labor shortages began courting workers by offering them health benefits. Employees were under wartime wage controls, but insurance coverage didn't count, making it an attractive way to provide additional compensation. And then in 1954, the IRS gave employer sponsored insurance an even bigger boost when it made health benefits tax exempt. After years of debate, Medicare and Medicaid started in 1966. Medicare was a straightforward program that covered all adults over 65. Medicaid was more complicated. It gave the coverage only to those already receiving cash assistance because they had conditions excluding them from employment. At the time, this included the blind, people with disabilities, and single women with children. Obamacare passed in 2010, expanded Medicaid to anyone who earned less than 133% of the federal poverty line. They refashioned Medicaid to look more like Medicare, a program that covers everybody who meets a single condition. But Medicare only rarely charges deductibles or co-payments, whereas the average employer plan now has nearly $2,000 deductible before it kicks in. A few years after Obamacare passed, several Republican states began proposing adding work requirements to the program. Somebody who is able-bodied and receiving public benefit, they ought to have a responsibility, they said. Their supporters were elevating the idea that people wouldn't face much harm if they lose basic medical coverage. Newer research that uses a bigger data set has started to find out that insurance coverage and Medicare Medicaid in particular, does lower death rates. The connection is strongest when researchers look at older, sicker populations. There is also the financial and mental strain of lacking coverage, which can affect a person's well-being but wouldn't turn up in a study that strictly measured physical health outcomes. In covering Americans' health system, uninsured patients are too scared often to go to the doctor because they fear a large bill on the other end. Another problem, emergency rooms refusing to see patients who did not have the means to pay. This led to the Emergency Medical Treatment and Labor Act, which requires emergency rooms to provide, quote, life-stabilizing treatment to everyone, even the uninsured. Uninsured Americans can be scraping together the care they need from, let's say, free clinics and emergency rooms, but they may be doing so at a great personal cost, arranging childcare for a long wait or having their paychecks garnished when they can't pay the medical bill. With some 10 million people expected to lose their Medicaid in the decade after the domestic policy bill, or having, and I think that goes into effect 2027, more patches may soon be needed in the system. The Medicaid work requirement in the bill does not affect us in the United States until maybe 2027, as I've said. And in the last minute, the Senate added a waiver provision that could push the policy back to 2029. So, is healthcare a benefit we all should be striding for everyone, particularly the ones at the margins? Give me your comments. I'd be happy to respond to you on this. And again, thank you for listening. This is Ken Barron with the National Association of Black and White Men Together. We try to put forward all the policies that hurt people at the margin and are in opposition to our basic charter of fighting against racism and homophobia. See us on many platforms, and including Facebook, and our major website is nabwmt.org. Again, thank you so much.